Now let's see in this video, are there any other factors which can affect the inflammatory markers other than inflammation itself? You see, inflammatory markers can be influenced. There are several factors which can influence inflammatory markers in the blood without the inflammation being present itself. These may be one which can increase inflammatory markers, the other can decrease the inflammatory markers. The ones which can increase age, you see in older age there are higher levels of inflammatory marker. For example, ESR is more in older people. And then obesity. Obesity itself is a state of low-grade inflammation, but despite that, the inflammatory markers are more than if this factor is corrected even. And then certain diets containing saturated fats, trans fats, refined sugars can be with higher inflammatory markers. Certain medications can increase inflammatory markers like haloperidol and tricyclic antidepressants. And then stress and sleep disorders like insomnia and other sleep disorders, they can also increase the inflammatory markers. And then let's see the factors which can decrease the inflammatory markers. Smoking is one which can reduce the inflammatory markers. And then certain medicine, for example, statins, can decrease the inflammatory markers. Immunosuppressants can decrease the inflammatory markers. And then physical activity. Physical activity has a complex relationship. Mild to moderate activity can decrease inflammatory markers, but strenuous activity can increase inflammatory markers. Then advanced liver disease, although inflammatory markers are generally increased in advanced liver disease, but the proteins which are being produced by the liver, they are decreased, so they may drop in some patients. And then immune suppression, you see patients having immune suppression because of the disease itself or because of drugs which are being used to control the immune system. They may have lower inflammatory markers. Only in a few diseases they may have increased inflammatory markers. Generally, immune suppression means the inflammatory markers may be disproportionately low as compared to the inflammation.